Mr. Chairman and members of the committee, I'm pleased to be before you today with Assembly members Bass, De La Torre, Hernandez, De Leon, and certainly not sitting here but playing a key role in this product, this bill which we're presenting today, because he has to chair the committee, is Assemblymember Dineley. But I'm very pleased to be before you addressing the issue of health care reform. You know, this is one of the most long-standing and most pressing issues that confronts us as policymakers, that confronts us as lawmakers in California, but throughout America as well. There is no area, Mr. Chairman, of greater state interest or urgency today than strengthening our fragile health care delivery system. Because I believe ultimately this system is going to fall on us if we don't fix it. Assembly Bill 8, which is before you today, encompasses a very broad approach to reforming California's broken health care system. The way that we approach this is based on a very valuable principle. That is the principle of shared responsibility between government, individuals, and employers. AB 8 contains 5 important provisions that I want to point out in the hearing today. One is major reforms to the insurance industry. 2 is an expansion of public health care programs. 3, key measures to contain the cost of health care in the system overall. 4 are measures to improve and reward health care quality. And last but not least, provisions that in effect would strengthen the private health care market. This issue clearly ought not be a partisan issue. And I say this not to speak ill of my colleagues on the Republican side of the aisle, because they too have proposed legislation to address this issue. I believe that at the end of the day, this is a deeply human issue, members. Healthcare affects each one of us personally and profoundly. At its best, it alleviates pain and suffering, and it brings new life into this world. It sustains each of us as human beings, and it enables us to live with the type of dignity and independence that every human being deserves. But you know that 6.6 million Californians today, most of whom work hard to support themselves and their families, often don't expect health care in the same way the rest of us do. They live in fear of getting sick. They live in fear of missing work. They have the highest rates of chronic diseases, such as diabetes, that ultimately leads to serious consequences, such as blindness and amputation if left untreated. They ration the medications that they can afford. And I've talked to many people who take just one pill rather than taking 3 a day, so that that medicine could last longer. Their kids have little access to dentists, and they have the highest rates of infection and dental disease. For these 6.6 million Californians, members, the healthcare system is something that is accessible only in the emergencies of life and at times of fear and times of loss. In a first-class state like California, the 8th largest economy in the world, I think you would concur with me when I say this needs to change. Covering the uninsured isn't just the right thing to do for the uninsured. It's the right thing to do for all of us, even those of us that are insured. Because if we don't fundamentally change, each of us will increasingly be at risk of losing what we now have. When a child gets an infectious disease, disease spreads regardless of citizenship or legal status. Who hasn't waited here for hours in an emergency room waiting to get the care that they need? I don't think that anybody believes that government, that employers, that employees have an endless capacity to absorb the cost of health care that are growing at 2.5 times the rate of inflation. This year, I believe we have a very rare opportunity, a chance to act, to set in motion fundamental improvements to our healthcare delivery system. I don't think that we can miss this opportunity. I want to get to some of the specifics of the bill for you and for the members of this committee. But first of all, Mr. Chairman, I want to say we did ask a couple of our colleagues to join us in presenting different portions of this. But I do want to say that this is a team effort. And truly, I want to thank you in particular, Mr. Chairman, for your thoughtfulness, for the contributions that you've made to this product, which is not a finished or a final product by any stretch of the imagination. But I would argue and I would debate anybody, any day of the week, any time of place. This is a sound product that ultimately will move California to where it needs to be, which is taking the leadership role once again as we've done in the past, this time in an area that many others have failed at, and that is improving the quality of health care.